other areas other than the beard be considered for a body hair transplant? If so, would grafts from these sites provide satisfactory results? Let's find out. Hello, I am Dr. Akanxa Bhatti. In my previous video, I told you about the benefits of the beard as the donor area. In this video, I am going to tell you about other donor areas in the body and how the characteristics of the hair at these sites vary from the characteristics of the hair on the scalp. The beard and the chest are considered as the best donor areas for a body hair transplant. Forearms and legs can also serve as reasonably productive donor areas. However, the growth of the hair at these sites still remains somewhat unpredictable. Other areas like the axilla, the back, the abdomen, or even the pubic region are somewhat labor intensive and are also not viable donor areas for both the surgeon as well as the patient. To begin with, I would like to stress on the fact that the hair harvested from a selected donor area would continue having the characteristics of the other hair in that same area. There are some important conclusions derived from various studies that I would want you to have a knowledge about. Firstly, the hair in the anagen phase of the hair cycle tends to have a superior survival rate than the hair in the telogen phase. Secondly, the ratio of the hair in the anagen phase to the hair in the telogen phase differs in different parts of the body and also from person to person. Thirdly, body hair tends to have a long-lasting nature as DHT does not cause miniaturization in the hair which is not from the scalp. This means that the hair shafts of hair which are harvested from other areas of the body do not have a tendency of becoming thin as time progresses. Lastly, body hair transplanted to the scalp tends to grow longer than the other hair in that selected donor area. The preference of the donor areas to be selected for a body hair transplant depends majorly on the duration of the anagen phase of the hair cycle. The scalp serves as the best donor area as it has the longest duration of the anagen phase, which is about 2 to 6 years. The shadow region of the beard is the next most preferred donor area as it has the same duration of the anagen phase as that of the scalp hair. The hair on the chest has an anagen phase lasting for about 1 to 1.5 years, making it the third most preferred donor area in the list. The hair on other parts of the body like the axilla, the abdomen, the back and even the pubic region has a very short anagen phase which lasts for only about a mere 4 months. This makes the hair on these areas as the last resort in hair transplant surgery. So how is a body hair transplant different from a traditional hair transplant? Well, a body hair transplant is usually a mega session in which around 3,500 to 6,500 grafts are harvested. In one session, it is possible to harvest around 500 to 800 grafts from the shadow areas of the beard, and around 500 to 1000 grafts can be harvested from the chest. So as multiple areas are involved in the harvesting process, it is not possible to perform the entire procedure in one single day. This is due to the fact that only a limited amount of local anesthesia can be safely used in one day. So the procedures with 3 sites serving as the donor areas are performed on 2 consecutive days in my clinic, and the procedures with only 2 sites as the donor areas, for example a combination of the scalp and the beard, can be performed on the very same day. So this brings us to the end of the video. Please subscribe to my channel so that I feel encouraged to share more knowledge with you. Also, please feel free to interact with me in the comment section below. Thank you for watching.